I think that there's definitely a stigma around addicts and addiction.
Some people might look out on the street and see a person who's super thin, not clean, or homeless, and think, oh, that must be drug abuse, that must be, there must be an addict. There's that general stigma that's there.
And people really expect that bias, and it is stopping them from seeking help because they're going to be treated as lesser. They're not going to be treated as they're fighting a disease.
For a long time, I didn't talk about it, because it's like, oh, well, this is something to be ashamed of.
They felt it from their families, they felt it from the community, and they've definitely felt it in healthcare.
And I get that people look down on people like me who, have had issues with drugs and alcohol, but you just never know what's going on with anybody else. You just never know. We can't make assumptions and judgments about people like that.
I think many times people use or are addicted because they don't feel like there's a light at the end of the tunnel. They don't feel like things in life are getting any better.
What are the other issues below the surface, and how can we stop that and help that? And it came back to that other question, what's the stigma? Everybody thinks, oh, drug addicts are criminals, they're all bad, they're all horrible. Well, that's not true either.
I think that one thing we can do to destigmatize it is to realize that these people are somebody to somebody else. They're a friend, their brother, sister, aunt, uncle. They're somebody.
These are human beings suffering from a really difficult condition. And it's one that wrecks so much of their lives.
There's shame, there's guilt, there's a whole host of emotions that we could go through that come with this, especially before we were talking about disease. It was somehow, a character flaw that I have. I just don't have willpower to stop. Why don't you just stop? Well, if it were that easy, wouldn't you think that most of us would just do that then?
We've really got to address that bias within our health care, or we're not going to make people feel comfortable coming to us for help.
And we need to care as, even fire department members and law enforcement, we still need to keep that sympathy. And, it's some people, it can be tough when you deal with that a lot to keep that sympathy, but I think it's very important.
I think honesty, being open and honest about it is the biggest thing that we can all do, not keep it hidden. We actually should talk about them more so that people can be more open and honest and caring with each other.